And if we were going to build a brand new hospital today, it probably wouldn't have 13 beds because the majority of the care provided is done in less than a 24-hour stay. A patient can actually have a hip and be out in a couple of days. In the early stages of developing that particular specialty, it was a 1 or 2 week stay of constant rehab. And so there are a whole list of services that used to be 2-3 days in the hospital. Childbirth, they're making plans to discharge the mother in 24 hours. And it used to always be a 3-day stay. And those are all in the numbers just 10 years ago. So it's really that the change in care delivery has driven what type of a building you need to deliver the care.
Yes?
Has this board projected how many dollars they need to raise every year to keep this hospital afloat? And has the hospital board done the research to find out if the community will donate those dollars?
The answer to the first question, I would say, is yes. Unless we did that, we would be poor at managing the business. The second answer to that is community involvement and donations are definitely improving. That is for sure. And that comes from improvements at the hospital. Financial and quality, which is still good and hasn't ever been an issue.
That doesn't answer my question truly. If you need to raise X number of dollars, have you polled the folks that are most likely to give in this valley and found out that they will in fact support a nonprofit model?
Can I ask another question, or can I respond to that as well? I don't mean this confrontationally, but how much are you willing to give, Ann? So, and that's a rhetorical question, you don't have to answer. But secondly, yes, we are actually in the process of a major project in which we are first assessing our community needs. What does this community need from its hospital for health care? Then we're assessing how can we achieve that? What do we get? What do we need to accomplish that, and where is it going to come from? We are in the process of doing that. The early stages of it, I will admit. But within the next 6 months, 3 to 6 months,
Yes.
it will be accomplished.
We also started on a new path this summer to meet individually with the people you're referring to and tell them our situation and tell them our vision for the hospital and seek their support. A year ago, in the previous fiscal year, our foundation raised $170-some thousand. And this year we just completed, we raised through grants and private donations $355,000. And we have pledges that reach out into future years, and we're in the process of building that up as we speak. And we focus on the summer because we can sit outside to eat, but we also do it because a lot of our seasonal residents are here, and we have been diligently following that process because a great critical access hospital operation would be one that breaks even. A tremendous operation would be one that makes 3 or 4%. And if you do the math, that will not keep up with our future capital needs.
And so there are 3 words I didn't hear you mention in your great answer. One is endowment, and the other 2 are capital campaign.
They're in the cards.
And really, it should be the board that's answering this, or not you.
Yeah, but I'm the one that's been out with the asks along with Diane, because we know the operation and can answer the questions the hard questions that we get asked. And we are very, very optimistic about the future. And we think that it takes philanthropy. And I've done 2 capital campaigns when I was at St. John's, and with great success. And we have the same potential and the same level of interest at the early stages that they had 10 years ago.
And donors do want to support something that they can trust. And I feel that in the past 3 years, a lot of donors have actually told us, we're waiting to make sure that you can get your feet on the ground. We're waiting to make sure that you can really create those better systems and efficiencies. So this was a huge vote of confidence in us that we were able to have a record-breaking year and then have sizable pledges throughout the next 5 years. I think it says a lot about where the donors' kind of mentality is as well.
Well, and it provides comfort to the taxpayers that you're not going to attempt to come back with another levy.
Absolutely.
Well, and I think that was one of the main drivers of the whole conversion process. Because we talked about the different models that we could potentially be under, a health district, private not-for-profit, an outright sale, and so forth, a private entity and so forth, or a for-profit private entity and so forth. The county commissioners and the board of directors really took the culture and the opinion of the Valley residents in considering how do we minimize the impact to our residents from a tax levy standpoint or from a taxing standpoint. And this model that we've decided to go with absolutely minimizes that better than any other model that I have seen. And as I mentioned, I've seen a lot of them. That is what the main driver, the main goal that I can see from the county commissioners and the board of trustees is to make sure that they develop the structure that we would not have to come back to residents and ask for tax support.
Tony?
When you had your strategic planning offsite last year, did you share your SWOT analysis with the Bingham folks?
They were there.
Yeah,
there.
they participated.
Okay, was there any particular area of that really excited them, or was there an area that particularly discouraged them from wanting to bid lease?
No, I thought that I think they sat at the group that worked on finance, and they sat at
I was on community relations with Lewis Crammond, the CEO.
one of the consummate CEO marketers I've ever seen. And they just were there like an advisor to help facilitate the process. And as they were with their entire consulting agreement, it was still ours to implement all their ideas. And I kind of equated it to putting out a 4-course meal and only having the ability to eat through the hors d'oeuvre at one step. And so they're very resourceful and very creative, and we think that we could continue to learn more. With a management agreement, it's going to have metrics and benchmarks, and that's the difference between the previous arrangement we had. We could only choose so much. If they see that this is a critical decision that needs to be made, they can put more horsepower behind the process so that we can stay on track. We have an admin team with 4. It's similar to what the hospital had 5 to 6 years ago. And we have a management group that with 165 employees, we've got 13 people that have management responsibility. So not a tremendous amount of depth, but all very qualified and all committed to being in a small hospital.
If I could add to that, one thing that I've noticed about Bingham Memorial Hospital is they don't make very many bad decisions. They know us very well for our previous 2-year relationship, as we've discussed, but they are very business savvy, and very healthcare savvy. And for them to choose to enter this agreement with Teton Valley Healthcare speaks volumes to us, honestly, that such a savvy organization, skilled at their task or at their work, has decided to throw in with us, really speaks volumes.